My name is Dr. Terri Mack-Biggs, and I am a medical director with Hospice of Michigan, and I've been with the company for over 5 years. It really is a pleasure and an honor to serve people at their end of life. I decided to become a physician. Actually, it has been a lifelong dream since I was a child, but I had many occupations in between the final decision, probably about 20 years in between. So I was a late bloomer to the medical field. And I really always wanted to be of service to people, and that is why I chose to be a physician. And the stars aligned up, and I was able to do it. I chose to be a geriatrician and a hospice physician because I really think that as a society, we don't do a good job of taking care of our elderly, and especially we don't do a good job of taking care of our patients and families when they're dying. And I wanted to be one of those physicians that really made my work count. I really don't think that I chose Hospice of Michigan, but rather they chose me. And I'd almost like to say, because the street it's on is Mack and part of my last name is Mack. But actually, again, things just worked out so well. There was supposed to be another physician to take this position, but she moved out of state. And I was referred and met with Dr. Paletta at a conference, and we hit it off, and it's been the best place for me. But I also have to say that I knew Hospice of Michigan before I was seeking employment with them, because as a medical student, I actually did a rotation at Hospice of Michigan and worked one of the days for their grand opening. So I was meant to be at Hospice of Michigan. One of the unique opportunities as a hospice physician is that we are able to go into patients' homes and actually wherever they reside, whether it's a long-term care facility or adult foster care. And this is really an honor for people to invite you into their homes, so you really get a good sense of what impact you can have, not only just on the patient, but also on the family. The favorite thing about my job is not only medicine, but during our interdisciplinary team meetings, we have the opportunity to talk about spiritual issues and social issues. So I'm not limited in the things that I'm looking at for a patient. And it gives me the opportunity, and our patients the opportunity, to be looked at as total human beings and not just from a medical perspective. My job, and I would like to think of it more as a career than a job, is really meaningful to me. And it is meaningful to me because I can see that what I do and what my team or our team does is really impactful to patients and families. And I think that is the most important part. And that is a part that not only gives myself, but gives our team the fulfillment of joy, even though there can be a sad time, and it is a sad time for patients and families when someone is dying. But to know that you are able to go in there by patients requesting you, but you're able to go in there and help them through this process as best you can.